LAN Health Initiative, LHI, an NGO, has urged Nigerians dealing with depression to seek professional help rather than resort to drug abuse or suicide. Angela Brown, co-founder LHI, gave the urge in an interview with the News Agency of Nigeria during a mental health and drug abuse awareness campaign in the NYSC orientation camp in Abuja. Brown stressed that depression, drug abuse and suicide had become an epidemic in Nigeria, saying to control this epidemic, the government must first acknowledge that there is a problem and put measures to tackle the problem before it gets out of control.
There's a lot of challenges in Nigeria that is making mental illness to become an epidemic. It is an epidemic right now, and because it's left undiagnosed, untreated, and there's a stigma, there's a big stigma. You know, if something is wrong with you, you don't want to talk about it, that means you're crazy, something is running in your family. So it's like that also creates a lot of problem. You know, mental illness goes undiagnosed, it goes unchecked, it goes untreated, and it goes on, you know, people don't get any help. The youths are depressed, there's a lot not going on. So we've come up with a solution whereby we educate people on how to do self-care, how to manage issues, and how to get help, and refer them to the appropriate skilled practitioners that are going to help them out.
Dr. Nkechi Mbazwe, co-founder LHI, said that while anyone could develop problems from using drugs, vulnerability to substance addiction differs from person to person. Mbazwe said that taking drugs causes a rush of the hormone dopamine in the brain, which triggers feeling of pleasure. The brain therefore remembers these feelings and wants them repeatedly.
I think the government can really play a big part. Funding for mental health is very limited here in Nigeria. We don't have a lot of psychiatrists to the population of Nigeria. I believe probably about 300 per the whole population. We don't have a lot of counselors. So I think passing the Mental Health Act will go a long way to provide funding to stamp out the stigma about mental health, and to provide resources for those who are having problems and to need recovery. Mental health illness can lead to complete recovery and complete functioning of life. And I think this is where we need to raise the awareness that we all need to partner together to provide resources for people to recover completely.
Some core members who spoke to NAN had this to say.
Drug abuse is something that has eaten up our social development, and it is indicting to our economic activities, because almost 80% of the youth throughout the 6 geopolitical zone is indulging in one way or the other, is abusing the drugs, both codeine, both tramadol, both marijuana, cigarettes, and so on and so forth. The government should set up a disciplinary act through the necessary means through the National Assembly, in order to have a right to rule, to penalize those youths, to have an scapegoat, so that the upcoming youths can learn and they can be able to form themselves, they can be able to position themselves in a way that we will have a good and a greater heritage.
Like I've watched movies, outside movies, white movies, where they get kind of a facility where you could go there, talk to somebody or a group, and you'll be encouraged and all that. I think if the government can provide something like that, I think it would be a good one.